kids, teenagers, young adults who just hold that thing there when they're talking to you or walking around. And it's important to educate them that this is something that is so harmful. It causes these small micro combustions or fireworks, and not the good kind, inside your lungs that can cause an untoward amount of problems for your lungs. As we smoke and vape these materials, there are all those different things that can happen inside your lungs as well. So the question then becomes, why do people keep smoking? And people keep smoking because they're physically addicted to it and they're mentally addicted to it as well. But there are ways that you can, if you know somebody who smokes or are one of those people, that you can approach your healthcare professionals to see how you can quit smoking. And there's so much literature out there. There are many, many ways to skin this particular cat with, mindfulness, with willpower, with medications, with prescriptions. So there's a lot of help out there, in the same way that the tobacco companies have put out this agenda to make it addictive. At the same time, the healthcare industry has been working on ways to combat it as well. This is a very important slide that I have up here. And what it shows is what happens when you quit smoking. It goes from minutes to years. When you talk about minutes, months, and weeks, you already start feeling better. For those of you who have lung disease or know somebody who does have lung disease, regular oxygen or air irritates their airways, let alone putting in smoke into your actual airways. The example I talk to my patients about is you wouldn't go out and put your car on and put your mouth at the exhaust pipe. Then why would you smoke? And this is a very important slide because it takes up to 10 years after you quit smoking for your risk of lung cancer to come down to somebody who didn't smoke. And it takes up to 15 years after you quit smoking for your risk of heart disease to come down to somebody who didn't smoke. So if you start today, there's still some work your body needs to do to heal itself by 10 to 15 years. It's never too late to quit smoking, but the earlier the better. So how many people here know somebody who has COPD, emphysema, or chronic bronchitis? By show of hands. Right? We all have somebody who either has it, maybe one of you are afflicted by it, or a family member, or a friend, or a neighbor, or a colleague who has this disease. And COPD is basically destruction of the lung that happens most often, about 90% of the time, from smoking. It can cause shortness of breath, it can ruin your quality of life, so that you can't do the things that you would normally like to do, and it can be a sequel of that as well. It's divided into two different types. And the reason I'm telling you this is you're going to hear different ways or names for this. One is something called chronic bronchitis, and another one is emphysema. And both of these are basically destruction of normal lung tissue into having a diseased lung, or COPD. I want to talk about lung cancer for a second because it's a good segue from smoking. If you look at this slide up here, it's the leading type of cancer death in the United States between all types of cancer. And the slide at the bottom there, it's a little difficult to see from this distance, but what it shows is that in men, the most prevalent cancer is prostate cancer. And in women, the most prevalent cancer is breast cancer. However, the number one cause of death from any cancer is lung cancer. And the number one cause of lung cancer is smoking. And there's a map there of the United States where the risk of lung cancer is the highest where we are in the states in the southeast of the country. So we are not only at risk because of our population, but because of where we live, our socioeconomic factors. So it is more important for people, for all of us from Mississippi. Ms. Knox accidentally said I was born here. I wasn't, but it's been a year enough that I consider myself from Mississippi. So I think that this is a problem that we all have, and something that we need to recognize and understand, that maybe in other parts of the country, but more so where we are right now today. What can you do about this? Let's say you know somebody or are a patient who who smoke for a certain number of years. There are now guidelines out there for you to actually get screened so that lung cancer can be picked up early. And why is that important? It's important because by the time lung cancer becomes symptomatic, and by that I mean by the time you have symptoms from it, God forbid, coughing up blood, weight loss, and other things, it is generally an advanced cancer. We now have technologies where we can pick up nodules less than a centimeter, and we can go biopsy those, and we can remove that cancer if it's picked up early. But who is at risk? The people who are at risk are there. If you know someone between the age of 50 and 80 who either currently smokes or has quit smoking in the last 15 years. Remember, I spoke about 15 years? And if you at least smoke 20 pack years, so if you smoke 1 pack a day for 20 years, that's 20 pack years. But if you smoke 2 packs for 10 years, that's 20 pack years. And God forbid, if you ever smoke 20 packs a day for 1 year, that's also 20 pack years, but I'm hoping I never meet that patient. All right. So why is that important? It's important because today, as you are here in Meridian, we have the technology to go and get those lung nodules. We recently acquired something very, very state-of-the-art, very special, that is only available in Meridian. You would have to go all the way to either Jackson or Birmingham to even get this technology, and it's called robotic bronchoscopy. We can actually go down and sample those small lung nodules. And the little GPS picture that I have there tells you how we do this. We put in the little lung nodule as a destination, and then we navigate there. We don't make any cuts, we don't make any incisions, but it's important for patients to be able to recognize who they are the at-risk population, so that the next time you go to your doctors or your nurse practitioners, you can say, hey, I am one of those patients, and could you please perform a lung cancer screening study on me? And that's so that you can get picked up, you can get diagnosed early, and you can get treated early. And we're fortunate that we can do that today here in Meridian, Mississippi. So then the question is, how can I keep my lungs healthy? The first and foremost thing that you can do is, unless somebody has a potion where you can reverse aging, we're not quite there yet. But the first thing is, don't smoke. And if somebody smokes around you, tell them the effects that they may have on their body. Secondhand smoke, third-hand smoke, these are all things that can be harmful. So as a community, if we help those who are smoking, because smoking is a disease, is an addiction. If we tell those who are smoking to quit or send them the right way to help them to quit, that's important. The second thing is to get regular checkups, avoid exposure to air pollution, and this one is a little bit difficult because you're not going to change the quality of your air overnight, but you can avoid areas, for example, that have large campfires or wood fires or so. You protect your lungs. Exercise, get out there. Exercise is the single most important thing that you can do for your lungs. And this doesn't mean that you need to run a marathon or become the next Usain Bolt, but this does mean that every day, if you walk 2 minutes today, try to walk 5 minutes tomorrow. If you walk 5 minutes already, try to do 10 tomorrow. And it is the ability for your body to push itself a little bit more so you feel a little short of breath, you sweat a little bit, and your heart rate goes up. And that is excellent aerobic exercise. And if you do that, it will allow your lungs to remain healthy and actually slow down the aging process. That is my team. I am very, very fortunate to have an amazing team work with me. There are many, many people. There are a few here. Those from Oxford Rock, raise your hands. I'm going to call you out. So they're out here today as well. Nobody can do this alone. Every facet of care that you get is because there's a team that comes together to help you do that. So like we are a team here in our hospitals, you guys are the biggest team ever in the community to spread this awareness, to let those who you love and who are afflicted by lung disease know how to help take care of their lungs as they move forward with life. So thank you very much. I'll take questions.